Hi, my name is Michaela and I'll be performing an NG tube insertion. So I'm gonna go ahead and go inside my patient's room and introduce myself. Hi patient, my name is Michaela and I'll be your nurse for today. So your doctor ordered you an NG tube because you have a bowel obstruction. So an NG tube is going to be a small tube that will be inserted to your nose and it's gonna be a little uncomfortable. Are you in any pain right now? If the patient is not in pain, I don't have to give him or her any medication. So I'm gonna go ahead and verify the order again with the doctor and gather my supplies. So for my supplies, I have a nasogastric tube, a water-soluble jelly, a cup of water, a 20 to 60 ml syringe with an adapter, a MSS basin, a pH test strip, a stethoscope, and a towel, and also a pen and a pen light. I don't have a suction apparatus set up, a canister, and a safety pin. Now that I've gathered my supplies, I will verify my patient's name and date of birth. And I'm gonna go ahead and raise his or her head to a high Fowler's position. Okay, before inserting the tube, I'm gonna go ahead and measure the tube starting from the nose to the ear to the xiphoid process. And once I've measured that, I'm gonna go ahead and mark it with a marker so I know when to stop. Okay. So now I already did my hand washing and privacy. I'm gonna put my gloves on. Put a towel. And lubricate the tube. Okay, and I'm going to assess my patient's nostrils to see if there's any obstructions. Since everything is clear, the patient has no airway problem, I'm going to insert it in the right nostril and ask him to take a sip of water. So now I'm going to go ahead and insert the tube. Okay. Take a couple of sips of water. And if I feel any resistance, I'm going to retract and ask the patient to tilt his or her head. And encourage to sip more water and swallow. Okay, once the tube is 2 to 4 inches, ask the patient to swallow again. Okay. Once it's inserted, I'm gonna go grab my tape. And secure the tube in the nose. And also, you could put tape by the cheek so it doesn't drag down. You could also put tape by the gown or a safety pin. Once it's secured, I'm gonna go ahead and aspirate some gastric content to make sure that the tube placement is in the right place. Once I've aspirated some gastric content, I'm gonna put it in the glass, a cup, and measure the pH level. pH level needs to be at least less than 5. Okay, once that is done, other facilities can require a chest x-ray after the NG tube insertion to make sure that it's in the right place. So after the chest x-ray, I'm gonna go ahead and place my stethoscope over the patient's epigastrium and inject 20 ml of air while listening for whooshing sounds. Once that is done, I have to make sure that the patient's tube is not dragging so it doesn't get pulled. Okay. So everything is secure. I'm gonna go ahead and clean the bedside, put the patient in a lower and comfortable position, clean up my supplies, and document, and perform hand washing.